Hi, I'm Mina Malik Hussain and you're watching The Coffee Table. About a month ago, we had a show on the coronavirus, and back then, it seems like such a long time ago, just 1 month, that show was about information. It was about trying to debunk a lot of myths about the virus. But from then and now, things have changed drastically world over, and we are now dealing with a pandemic. We do know that it has arrived in Pakistan. The numbers are increasing day by day. And at the time of this shooting, Pakistan has 510 confirmed cases of COVID-19. So we know that it's here, and we know that we need to do something about it on an emergency footing. Now, again, the purpose of this show is not to panic anybody, but we have to be realistic, which means that we have to stick together and we have to have the right facts and the right kind of information. And in order to do that, today we have two experts on the show, two very well-informed, very sensible doctors who you must take seriously. We have Dr. Usman Malik, who is an assistant professor of rheumatology at the Shalimar Medical and Dental College. And we have Professor Dr. Maryam Riaz, who is also a professor of pathology and virology at Shalimar and is in charge of the infection control at the hospital. Hello, doctors.
Hello.
Welcome to the show.
Thank you so much for
very
inviting
sort
us.
of unusually somber introduction for this show usually. But, you know, we're in the middle of a serious thing and we need to sort of be serious about it. So let's sort of, I want to just kind of begin at a sort of intermediate stage, because I think that now it's pointless to talk about how did it get here and whatever, it's here now. So just to kind of reiterate for our audience, Dr. Tarar, what are the symptoms of COVID-19?
I think first of all, we have to understand that everybody is kind of confusing it with the flu.
Yes.
People are saying that, so I think we should clarify that first, that flu is called by viruses which are different. They have a different family. And this one is, this condition, which we are referring to as COVID-19, is caused by a different group of viruses, which are coronaviruses.
Right.
And hence, we are referring to it like that from time to time. As far as the symptoms are concerned, the main symptoms that are at the moment are actually fever and cough. Right. And then it kind of moves on to shortness of breath or difficulty in breathing, as we call it.
Okay.
So these are the main things which people are, you know, telling us, especially, you know, the data coming from China and all the other European, you know, countries. You know, this is what we have at the moment, that it is fever, cough, and then, you know, when the symptoms become from moderate to severe, then people have difficulty in breathing.
So what sort of what fever levels are we looking at? Is it sort of more than 100?
I think if somebody has fever, you know, I think we should take it seriously. So we can't really differentiate on that.
Right.
Sometimes, you know, if it's a young person, maybe he will not have that higher fever, but nevertheless, he may be having the infection, and maybe it's not that severe anyway, that he or she will take it seriously. So I think fever, I know of some people who are coming from UK and other places, because all the students are now coming out of the hostels, and they are trying to get here to Lahore. And the calls that I'm getting, you know, they are like, you know, my son had a bit of fever for a few hours while he came back from Islamabad, and then on the bus, and then here to Lahore, and then some cough, but now he's all right.
Right.
So I think these are the cases in young people that they don't have high fever, but they are saying that they have fever. It could be 100, 101.
So even if it's 100 or 101, it's still something that you should take a little seriously. That counts as a fever.
Yes, because I think in our hospital at Shalimar, just as of day before yesterday, we have got the guns, the screening guns. And, you know, the baseline is that if the temperature is above, you know, the normal, then we just screen those people out at the entrance of the hospital. And all the entrances, you know, people are just doing that. Our guards are doing that to ensure that somebody who has the fever and is not actually telling anybody that they have the fever would be kind of picked up.
So temperature is a good way to gauge if somebody is not feeling entirely well. And a cough, a dry cough?
Yes, I think dry cough at the moment. I think initially they will have the dry cough, but then when it becomes more severe, And then I think the cough will not be that dry because they may end up in having bacterial infection on top of that.
Wow.
On top of viral infection, they may have.
Which really does confuse the sort of situation.
I mean, it usually happens with with influenza viruses as well.
No.
I myself had, H1N1 and then had pneumonitis and then had the bacterial infection on top of that, but kind of survived. And that's why I'm sitting here.
Exactly. We all will survive.
Yes.
Inshallah. Okay. So Usman, Dr. Malik, to you. A lot of people have been saying that testing, so as far as testing goes, if you have these symptoms, what should you do? So because like Dr. Tara rightly said, these are very mild symptoms. And I think for a lot of us who are social distancing, I think sometimes we think that we might have these symptoms. It's become sort of almost a little psychological. But if you do feel a bit unwell, you have a slight fever, you have a bit of a cough, what is the sort of appropriate thing to do at that point?
So, Mina, at this point in time, I think we don't have enough testing capability to test every single person who has mild symptoms.
Yeah.
So I think PM Imran Khan talked about this in his first speech, I believe, where he asked people with mild symptoms to try to stay home and not go to the hospital. And there are multiple reasons for that. So the number one reason is if you have mild symptoms and you go to the hospital, you risk exposing other people in case you have COVID-19. Number two, most hospitals don't have testing capability at this time anyway. So even if you do go to the ER, which is not a designated COVID-19 emergency room, they will not be able to test you. You will expose people and then you will be sent back home. So it's probably better, I think, and more realistic for an under-resourced country like Pakistan that people with mild symptoms stay home. I think most of the medical community would agree on this. Quarantine themselves, self-isolate for at least 10 to 14 days, and try to be cautious. Try to maybe have a designated COVID room in your house, a fever room in your house where you stay, and you try to avoid mingling with other people, even family members. And I know medical doctors who are doing this in Pakistan, in the UK, in the US. In fact, in the US, there are doctors who are living in their garages now. They're not even living inside their house. So they've moved out to minimize exposure to their loved ones.
So, Dr. Malik, what is exposure? Like, what does it mean to be exposed or to be a source of exposure to somebody? So,
the good news about this, about COVID-19 that we have talked about amongst ourselves before is that exposure in this situation means close contact. So, most people would say between 2 to 3 meters is adequate distance that you can keep when you're social distancing. And the transmission is mostly via droplets. It is not really aerosolized as much as other viruses are. For example,
so aerosolized means that it doesn't travel in the air so much.
So it doesn't travel or stay in the air for too long. So there is some evidence that is coming out that it may survive in the air for up to 3 hours is what I'm hearing and what we are seeing the numbers. But it is not as bad as measles, for example. So we still believe that most of the exposure and most cases would be transmitted via droplets. So if you cough and if you sneeze and the droplets land on a surface, someone else comes along, picks up the droplet and takes it home. So if you're not in close vicinity or proximity, your exposure risk does go down unless someone is literally, sneezing secretions on your face.
So for example, if you are on a plane or on a bus or in a shop, where there are lots of people around you and you can't necessarily maintain that distance, it is quite likely that everyone is exposing each other to whatever germs they have.
So there's an epidemiologic term called R0. What R0 means is that every person who is infected has a potential to infect between 2 to 3 people. So the current R0 that I'm aware of is 2.4. So one infected person is going to give it to 2.5 more other people or 3 people. So if you are in a shop in close proximity and right on top of the other person, you are going to get exposed, and you are probably going to infect other people because the incubation period where you're totally asymptomatic, you have no symptoms, can be almost up to 10 days on average.
Wow! So you can be showing no symptoms, and for up to 10 days still be dangerous, for a lack of a better word.
So between 5 to 10 days, I would say.
Between 5 to 10 days.
But I think the point that you mentioned of 10 to 14 days for the quarantine thing that you mentioned earlier on, I think we would rather stick to 14. Because it's safer. This is the information that I'm giving to all the families whose children are coming back. And also if they have somebody at home, because the other question is, I have my grandfather and grandmother who are either diabetic or hypertensive or asthmatic, and our child has just come home. So what I was telling them was to actually isolate the child, adult child who is ever coming back from UK, and do not meet the grandparents, or else have this thing they would have to do for 14 days otherwise, because we do not know where they might have picked up the virus from. In transit, before that, and they may take up to 14 days to even show up. The symptoms may not show up because that slot that it's there, where they haven't got any symptoms, or they may not even have severe symptoms or moderate symptoms even for that matter. This is the issue with the young lot, because now it's believed that the young lot is going to be having the infection. Maybe it'll be milder, but they'll passing it on to people, like me and like others who are not that young anymore. So they will be passing it on to their grandparents, and they will be the one who will be suffering. So we have to make sure that we give this type of information to general public as well. That this is they have to maintain that distance. They have to maintain like 6 feet. And I think
for those 2 weeks, because what you're essentially doing in those 2 weeks is ensuring that if you've been exposed and if you are a carrier, then those 2 weeks will sort of let you know whether you are or aren't for sure.
The other shortcut is, which I have been suggesting to people, that they can give the sample to private laboratories, because our government laboratories, the NIH and the Birdwood Road Laboratory, they will not accept samples, as Dr. Usman earlier mentioned, that because we are resource starved and we cannot test all these samples from people who don't even have the symptoms.
So we have reserved
so we have reserved those on the side. But if somebody can afford to have the test, they can go to a laboratory or ask them to come over, and they will take the samples, as one or two of the labs are doing. So in that instance, you will have the sample, and after 2 or 3 days, when you get the result, during that time, that person who has traveled from abroad, must stay indoors at least during those 2 to 3 days, and not mix up with their grandparents. That is my message too.
And even indoors means in your room.
Oh yes, I think we have to understand, as Dr. Usman also mentioned, that it's the droplets. You see, you are sitting in a room and you're coughing or talking. The droplets are going to be everywhere around you. And I was so happy when I came here and I had my N95 in my bag and I had my mask, and I was concerned, oh my dear, we are going to sit so close to you. And I'm glad that you people did it, that you disinfected the whole place. And I think it's a very, very important message to give to everyone, that whoever comes to you, even my clothes could be contaminated. I've been to the hospital. I can assure you that I didn't wear these clothes because I'm wearing my kit in the hospital, Dr. Usman, for the last 4 or 5 days. I wear it, and my overall and white coat comes back home and it's put in the washing machine. The next day, I'm taking my new kit with me. And yesterday in the Shalimar Medical and Dental College meeting that we had, because now we want to start the online courses for our students, because we can't just sit ducks. So, our principal Saab, obviously Professor Zahid Bashir said that we must get together and do this. And there I told everybody, because everybody was kind of asking lots of questions during this meeting.
The virologist gets the most questions.
And also because I'm also in charge of the infection control, and also the main person for the crisis management corona committee that our hospital has set up. So they were asking me.
You're going to get a lot of Google searches about you now. People are going to start calling you now.
They're already tired. My phone is already crashed, honestly.
Oh my God.
So I told them, I said, look, I have been wearing the mask for the last 1 month, and I've been telling you all the doctors, and I think Usman can corroborate that. So I told them, I'm using my kit, you can see me. And if you want to do this, you do it. I can't force anyone, but I know how the virus spreads.
But we should kind of be forcing it between you and me. We're going to take a very quick break, though, and come back to this in 1 second. Stay with us. Welcome back to the coffee table. We're talking about COVID-19 and what we are supposed to be doing to help protect ourselves, our families, and the people around us, and flatten the curve. So this is a phrase that's been sort of being talked about a lot, flattening the curve, flattening the curve. What does that mean, flattening the curve?
So the term originated from a paper that the CDC published in 2007, the Center for Disease Control in America. And so since then it's sort of taken over, epidemiologists have come. So what that means is you basically have a graph. Yeah. What that graph is showing is you have a surge in the number of infections and people seeking healthcare. So let's say you have a huge curve that goes like this, and you have healthcare capacity, which is a line right about here. If the total area under the curve, or the total number of infections, if it hits or exceeds the capacity of a healthcare system to support the number of infected people and sick people, you will crash through the ceiling. If that happens in 1 week, say you have 100,000 infections and you have 200 beds in a particular region, you hit the ceiling, you exceed it, the healthcare system is overcome and it collapses, which is exactly what happened in Italy and is happening in Seattle right now in the US. So let's say that you have a similar number of infections and the area under the curve is the same, but you spread it out over time.
Yes.
So instead of exceeding the healthcare ceiling, you spread it out, so you surge up and you over time you go down, and you flatten this curve from a big
spike, from a massive jump
to a exactly.
It's a more kind of manageable.
It's a plateau. It's a plateau that sort of goes over several weeks. So the healthcare system does not collapse. That is what people are referring to all over the world.
Yes.
And the idea behind that is, if you can do that, if you can suppress or mitigate, you give the system room to breathe, and the system time to create more resources, to create more beds, to buy more ventilators, to buy more masks, and protect the doctors and the first line healthcare workers who are going to be fighting this pandemic.
Because that's also something that's, well, we'll talk about equipment in a minute, but so flattening the curve, how do we do that?
So the measures for flattening the curve, I think most people would agree right now are two, mass testing and social isolation.
Yes.
So if we can clamp down, if we can create social distancing and social isolation, you prevent the pandemic from spreading too quickly. It gives you time. So if everyone, as an example, let's say you and I, we go home today, we lock ourselves in a room and we don't go out. We go out once a week or twice a week to buy groceries. We do minimal social activity. So the virus does not get a chance to spread very quickly. That gives the healthcare system, Mayo Hospital, Shalamar, the government, time to create more resources. So social distancing or social isolation is probably the single biggest contributor to flattening the curve.
Right, and which is why schools are closed, which is why a lot of people are working from home who can do it. So even when one is social distancing, what are the kind of things, what does that entail? Because I think a lot of people have a very fluid interpretation of social distancing.
So what that would mean, again, it's really, right now, if you look at the countries around the world, what you will notice is different attitudes about this. So the UK has a different attitude compared to South Korea or China. If you look at Pakistan, applying this indigenously, the things that you could be looking at is, if you're going to go out for groceries, go out no more than twice a week, for example. If you're going to cancel all weddings and large ceremonies, cancel funeral gatherings. It hurts me to say that as a Muslim and as a Pakistani, but maybe we should really clamp down on even mosque congregations, which is important, or any social gathering. The number that a lot of people say is 40, but I think even 40 is too large.
Too much. I really do think. And even on a smaller scale, I've read about this, canceling play dates for kids.
Canceling play dates for kids.
Canceling, like, even family gatherings that shouldn't be too large.
If I may add, as of yesterday, our organization is ahead of everyone, because yesterday was Friday, and I went up to Principal Saab, Professor Zahid Bashir, and he was just about to go for the Jummah break, because it's a big organization, we have many people, and most of them were there. And I said, Dr. Saab, can I just suggest that you do the Jummah in here, so that you will be spaced out 3 feet, aapki jo saf hai, that should be kind of this. And he said, fine, Maryam, we'll do it. And just there and then, it was so heartening for me that somebody is listening.
Excellent. I'd shake your hand, but we are social distancing. And yes, I realize the irony of talking about social distancing on a TV show with people on my sofa. I understand this. No, but don't comment underneath.
But the problem is, let me go further than this.
Yes.
Okay, educated people, and we are all frontline workers, healthcare workers, they're all listening now. Initially, they were kind of a bit skeptical when I would say up to them, Corona is coming and it is not going to tell you and it will come.
It's not.
And nobody was listening. But
all of you are medical professionals, but a lot of people who watch this show are just ordinary people, right? And I think that a lot of people have very sort of oddly fatalistic ideas about their exposure and oddly sort of superhero ideas.
No,
about
it's not even that.
They do not invincible we are.
They do not know what they are up against.
Yes.
Let me be very frank here, because I go to hospital areas on daily basis. For the last many days, I've been doing that, trying to figure out where we stand, because obviously we have to order different masks and gear because for the ICU staff, for the pulmonology staff, and we are doing that. But the people who are in the waiting areas in the OPD and outside the ICU and outside the ER, I've been explaining to them, Dr. Usman, just clearly, this is what it is. And they are saying, no, we are not going to budge. We are here because our loved ones are here and we are going to stay put. I've asked them, please, gents can stay here outside. There is one chair in the middle, leave it, don't sit on it. But they wouldn't listen. But in the OPD, yesterday, we have done it. We spaced everybody apart, moved out, and then you come back again, they're all sitting huddled together again. So this
is one of the massive problems, is that and again, for even people who've escaped quarantine, for example, or people who are exposed and not taking it
seriously,
they are not taking it seriously. The problem is that the first people who you will affect in a dangerous way is your family.
And the healthcare workers.
People they're the first in line. If you come home and you've been exposed, your family is going to suffer first of all. Like, forget about strangers. Yeah. So we were talking about flattening the curve, and Dr. Malik mentioned mass testing. Is that something that we can actually do in Pakistan?
I think it's not possible, as we have already mentioned that.
Like, and why would we really did it?
All the countries of the world which have trillions of dollars with them, even they can't manage this type of thing. They are telling everybody, they were changing their stance daily basis, hour to hour. I was up all night till 2 a.m. in the morning listening to, Al Jazeera and CNN and BBC and our own channels. They were changing their stance every few hours.
Yes.
Look at Boris Johnson. Look at Trump. Trump was calling it a hoax virus few weeks back, whatever. And now, look at them. Yeah. They are putting trillions of dollars just to get their economy going.
So because we can't do mass testing the way, for example, South Korea did it, because we don't have the resources. So that's why social distancing now is...
They did the mass testing.
The basic thing we can do.
They did the mass testing because they figured out that this infection is here. They had that precious time, which country like ours wasted mostly on PSL and stuff. We were concentrating on PSL more than this. We had a lot of time. When the Iranians came back, I started speaking to everyone that I could convey my message to, saying, listen, if thousands of Zairenes are coming back, they are going to be everywhere. Let's get our act together. But you see, that precious time is now.
So the first case,
so the testing is not that easy thing to do. I mean, again, mild symptoms. If we don't have the resources, number one, contact tracing and all this. Once the cat is out of the bag, as I say, then you have to manage your resources because containment is not that
even contact tracing sounds impossible.
Yes,
to do.
It would be in a situation like ours.
Which contact tracing is when you take an infected person and you trace back how many people that person has interacted with. But that sounds like something that it just sounds really impossible. So basically, then we kind of cycle round to social distancing and self-isolation as probably the only thing we have at the moment.
So right now,
our masses are not listening.
What we are talking about here...
Please listen.
So what we're talking about here, just so you know, New York City actually, in the last 48 hours, they changed their stance too. So they went from mass testing to social distancing and talking about locking down.
Right.
Because they realized that they think a lot of people in New York, what they basically said was we should assume that everyone in New York has been exposed. And so they went to actually social isolation and quarantining as their biggest measure and not mass testing.
What's the difference between social isolation and quarantining? Because it's also kind of like a spectrum of distance.
So social distancing would be when you're taking precautionary measures, right? So you're taking a lot of precautionary measures. You're following, don't come close to each other within, 6 feet, 2 to 3 meters. Stop canceling gatherings, whatnot.
Don't go to restaurants.
Don't go to restaurants or socializing.
No, but I think the difference is when it is enforced, it is quarantine. When somebody locks you up and says, look, you stay here and do not come out, and there is a police guard sitting outside. Self-isolation, short of that, you do it at your home or you are sensible enough to do it. You stay at home and don't mix up because you are an educated person and you listen to what is happening in globally. Quarantine is enforced onto you, and you have to stay in those circumstances like the Afghan border thing, which we have seen.
But does that also vary with the amount of how much of a risk you are? So if, for example, you or me, who are generally being sensible and taking precautions and don't have any symptoms, but if we stay home, that's self-isolation. But if you get sick, then you are quarantined.
I think there are many questions in that. If you look at the population, people, travelers from Iran, oh yes, I wouldn't go near them without wearing Man 95, honestly. I think anybody would do that.
Anybody who's been traveling.
And a full hazmat suit.
Yes, exactly. So this is the issue. But for somebody, like us or other people who have not been exposed, hopefully, I mean, I keep my fingers crossed. So if you're not exposed to that, then something would be different for them. So it's not the same. It's not applicable to the same because it's risk assessment thing, which we don't talk about that much anyway. In these circumstances.
And in this situation, it's strange because our risk assessment, we're kind of self-assessing also.
Yeah, that's right. It doesn't really...
It's a bit nervous-making because everyone's idea of risk is also so different and everyone's assessment is also different.
But listen, your response, that makes all the difference. If you look at Italy, and we know, my husband and we know many plastic surgeons there, and we have been asking them how you're coping with it. They are saying we are listening to our government, we are isolating, and we are doing all the precautions. You see, they are saying it's just two things right now, isolation and prevention. But does our population understand that?
Part of the reason might be because Italy has been very transparent about what's happening there. And I think that is something that I know PM Imran Khan talked about being transparent, and I think they really should be, because there are videos of Italian emergency rooms and ICUs that are circulating. And you can actually, and this is not just on social media, this is actually on NBC and CNN. So if you can see those graphic details with your own eyes, then, it puts a different perspective.
It hits
because right now, everyone thinks it's too far away.
It's somewhere else.
It's somewhere else.
And
it's the other
and also
who's in
this
trouble.
idea that I'm young, I'm healthy, I don't have underlying conditions, which is basically the information that we have at the moment, that older people or people with underlying conditions are the ones who are most at risk. But if you don't, if you're not, then you'll be fine. So this idea that even if I get it, I'll be okay ultimately.
So the WHO and CDC have been very clear on this. We know for a fact, because we've been looking at the data for the last 6 weeks, but more than that actually, the only group that is least affected with the least mortality is under 9 years old.
Which is just kids.
Which is just literally babies and toddlers. So above 9 to 80 and above 80, the mortality compared to the seasonal flu is about 5 to 20 times higher. And so that's across all age groups. So in France and in the US now, 40% of their hospitalized, severely ill population is young people that are less than age 60 and 50.
Okay, and
those are big numbers. That's almost 1 in 2 people.
That's very important to remember. We're going to take a very quick break and come back to this in just 2 minutes. See you then. Welcome back to the coffee table. We are talking about COVID-19 and all the sensible things that we should be doing to get through this. So first of all, it is true that ordinary soap and water, washing your hands properly with normal soap and water will disinfect your hands adequately.
Absolutely, that is true, because I'm telling everyone, even if the soap disappears, even if the hand sanitizers disappear from the face of the earth, which they already have,
kind of.
Even then, the mechanical, the process of washing your hands will help you get through most of the virus and other bacteria off your hands.
So is liquid soap better or bar soap?
Doesn't really matter. I think we should not go into that.
It doesn't
because
matter.
we know the formulation is the same. It could be gel-based or it could be bar, whatever you have, whatever you can get your hands on, that'll be fine.
Quite literally.
But I will add to that soap does tend to break the viral capsule.
Okay,
so it is actually, so if you have access to soap of any sort, please use it.
Yes.
So it doesn't matter, it doesn't have to be antibacterial soap, it can just be like a normal perfumed beauty bar even.
It can be anything.
It can be anything, but I think there is, the envelope of the virus has got the lipid in it, and what the soap does is, it breaks apart that lipid to an extent, maybe sometimes not completely, if you're not doing the process as you should, which is like 15 to 20 seconds. So that is the game changer, as I should say. If you wash your hands, let me use a word in Punjabi, kuchola nahi marna hathan nu. You have to wash your hands properly for 15 to 20 seconds. And I think, our UHS guidelines about the control of infection shows that hand as well on the top page, on the title page of the book as well.
So 20 seconds. There are a lot of really fun websites which show you a lot of different songs that you can sing for a 20-second duration, which really makes it easy. I think Happy Birthday Twice is also 20 seconds, which is the easiest thing. But you can sing a lot of choruses, like Queen, Bohemian Rhapsody. But so, Dr. Tara, can you demonstrate how to properly wash your hands?
Yes, I'll do that, and I will not do the Happy Birthday song. I would rather do, either Ayatul Kursi or something, because it takes exactly the same time.
All right.
So once I have it, and I've just foamed it up.
Right.
So you start off doing like this. These areas have got the maximum germs and viruses, which we tend to ignore. So once we do like this and we do like this, that will take the germs off from there. Then these are the areas again which have the germs. So we do like this, of course, both sides. And then this bit, which is like the
palm of our hand.
You either do this or do this, doesn't really matter. You don't have to be that perfect in doing that, but once you do that, it should be fine. And then there are areas up here which are left behind, even after doing these few steps.
After doing this.
So then you do like this.
Okay.
Right? And then all my clothes, actually, even they should be like this. So my kit is like this. So then at the end, we do the wrists.
Okay.
We have to do the wrists as well.
Okay, you have to do the wrists. Wrists get missed out a lot.
So once you do all these steps, I think 99% chance that you will be getting rid of most of the virus and bacteria from your hands.
Excellent.
Until you touch some contaminated surface again. So that means you have to do this process again and again. In the hospital, I've told everyone that if you do not remember, ask your colleague to remind you that you have to go and do this after 45 minutes to 1 hour. And
so if you're at home in sort of a generally self-quarantine, self-isolation, then if you do this every few hours, it should be all right?
That should be fine, as long as you're not interacting with people around you who are susceptible, who are immunocompromised, as we have already mentioned. So as long as you do that, because you see, the moment we touch any place, of course, you have disinfected it, but let me do this. If I touch this, I've held this mug, I'm putting my arm here. So all these areas are supposed to have the bacteria or the other viruses, which ordinarily wouldn't bother you. But because this is a pandemic situation, so we have to assume that everyone around me is infected with this virus, and I'm myself infected with this virus. Only then are we going to take all the precautionary measures. Really, and hand washing is the most important.
So hand washing, and this is a procedure that you should be teaching to everybody in your house, house help, anyone who's in your house or outside your house, in your workplace.
Exactly.
This is the correct procedure, and you've got Dr. Tara who demonstrated it very ably. Acha, Usman, how do we disinfect surfaces in our house or in the workplace, for example? Like if you can't work at home and you have to be out, which surfaces? What is a good way to disinfect a surface?
So, I mean, you could use soap to do it, liquid soap to do it. You could also use alcohol-based sanitizers. 60 to 70% is the recommendation, 70% is better. You could use bleach, you could use Dettol in Pakistan, you could use anything that has at least 60 to 70% alcohol content. So I have used soaps myself to clean surfaces if I run short of sanitizer. And I suspect that most of us are eventually going to run out of alcohol-based disinfectants.
Yeah.
So,
if you make a bucket of soapy water and then put a cloth in that and wipe stuff over.
Absolutely, and I would recommend adding a little bleach to it.
Okay.
And that would give you a little higher chance of killing the bacterium.
Yeah.
So the other thing, Dr. Taran, you were talking about before we forget, cell phones, smartphones.
Yes. So I tell everyone, I'm because this is what is happening all over around us, houses, colleges, hospitals. People have their phones with them. So I tell them, while you're doing all this, please don't forget your phone. That is your third hand. So that is something that I've coined just during last week.
So hashtag third hand.
Hashtag third hand. So please be aware that, once you have, cleaned your hands and you touch your phone and the phone is contaminated, you are going to contaminate your mask and your N95 and your clothes and everything, because, that may have the virus and it'll stay on there for a couple of hours to days as well, I think.
Because it's sort of droplets or germs remain on different surfaces for different amounts of time also.
That is correct. So the droplet will survive on different surfaces for different duration. Interestingly, there was an article, I want to say Atlantic, where they talked about copper being a great antiseptic surface. So they were talking about using copper in the future in more material as possible. Because people are thinking now 5 years ahead as well, and they were thinking about preventing pandemics in the future. So if you have copper wiring in the house, if you can disinfect it once, you can actually use that for your different surfaces that you use for utilization purposes.
Yeah. Should we be disinfecting household pots and pans and knives and forks and things like that also?
If you're using soap to wash them, you're probably okay. I think it should be all right, because if we are taking all the precautionary measures, as we have mentioned, and then we use the usual stuff that we are using, there shouldn't be any problems. As long as it is not raw meat and you tell your cook or your maids how to go about it, they should not leave it on the bench top or the surfaces, then I think it should be fine. The usual cleanliness, because I think Pakistan is forgetting, just by keeping yourself clean and in hygienic conditions will help you and take you a long way.
Okay. Yeah, and also for clothes washing, because I believe that the correct protocol, if you cough or sneeze, is to do it in your elbow, like cough, cough, sneeze, sneeze, and not on your hand, because then if you do it on your hand and you touch things and everything, the germs go everywhere. So if you cough into your sleeve and then you wash your clothes, then you're okay. Yes, you're okay, and you don't have to necessarily use, 100% alcohol to clean your clothes. Set your machine on fire. You just need to wash them regularly with regular soap and bleach, whatever protocols you use normally. The one thing I've been doing when I go grocery shopping is my 4-year-old goes with me. So when he goes, I make sure that he's not touching handrails. Yes. So this is extremely important. Handrails in public spaces, swings in parks, and slides, those are probably going to be heavily clustered. I call it H. It's hands, it's handles, it's horizontal surfaces. Great. I've told everyone in the house. Everything. But that's great. H. Hands. Handles, horizontal surfaces. Horizontal means this way. There's more chance that a big droplet will land on it and then stay there. And then stay there for some hours or maybe a day or two. So how many times a day should one be sort of cleaning handles, for example? Like, the heavy usage handles. You see, it depends on the contact, how many people are using that area. If you have cleaned it and nobody has been in that household, then why do bother? I think it's the people who are just spitting out or talking, and then they're depositing to your house. For a second, I was like, oh, what? And I'm like, oh no, it's okay. Now there is one sort of other sort of idea about the virus, which I think that I'm not quite sure about, but I just want to mention it because it is something that people do tend to mention, is that high temperatures will maybe kill COVID-19 virus. So the WHO and CDC on their websites are cautioning people against being optimistic about the fact that maybe humidity and heat will kill it. I will give people hope because I want to be transparent about this. There is a paper that came out in the MIT Technology Review, which did collate research, and there are hints that higher temperatures may slow the transmission. There is absolutely no clear evidence about this. There are no clear guidelines about this. This is just a potential silver lining. So maybe that will help. But at this moment in time, I think most of us will be very clear about this.
we still want people to take extreme measures.
Yes.
Yeah, do not count on this temperature thing.
No.
I've been telling, I've been telling everyone since quite some time, and
a
I
lot
just
of hot
smile at them.
countries-
I said, all right, let's see, time will tell.
Time
And a
will
lot
tell.
of countries with the virus are already in summer.
And also, there different zones, time zones,
And even in Africa,
exactly,
every single
they have
country in
different
Africa
temperatures.
has reported a case at
And
least.
Australia, it's been summer in Australia
Yeah.
all this time.
So-
So that's not necessarily true, guys. So in summary, in Pakistan, because we don't have the resources for mass testing, or even sort of setting up like fever camps, for example. But isn't it kind of contradictory? You set up a fever camp, and then a lot of sick people will come there also, and then everybody will be exposing each other. So it just
Definitely,
sounds really
definitely. Because you
freaky.
see, there would be just 1 or 2 people there who are incubating the infection. And if we put them, I've seen some beds lying like half a foot apart from each other. In that case, it's no use. Okay, if you are really putting them in quarantine, then at least have a distance of a couple of feet, 6 feet and more, so that they are not spitting on each other and talking to each other. There are people in quarantine, if in the same area, and they are talking to each other and roaming around, there's no point in doing all that. So you have to remember distance, distance, and distance.
Let me talk a little bit about fever camps or fever clinics. So Wuhan in China actually used this model quite extensively. And so they were able to tap into the fever clinics that they had earlier from the SARS infection.
Yep.
So what the basic idea is, instead of people going to the emergency room if they have mild symptoms, you go to a designated area outside the main hospital's body, which is to the side.
And you also mentioned how an ER is not a COVID-19 specific testing site
Correct.
either.
Neither a testing site and potentially nor a treatment site. They may not be able to do much for you, and they might just send you back home. But if you have a designated fever camp or fever tents right outside a hospital's body, where, let's say you have 2 guards outside the hospital's ER and telling people, no, if you have these symptoms, you go to these camps.
Yeah.
You go to these camps, and there are people with similar symptoms there. You get screened. If you are really sick, then they can transfer you to quarantined hospital. PKLI in Lahore has been designated as one of the hospitals, I think. But again, I think I will keep reiterating this again and again. If you have mild symptoms, please stay home. I think at this time, with our resources, it makes the most amount of sense to stay home with mild symptoms. Self-quarantine, I agree with Dr. Tarar about 14 days. 10 to 14 is still too liberal. We really do want to go a little bit more severe than that.
So disinfect your surfaces, wash your hands properly, self-distance, which means don't go out unnecessarily, don't
have
expose
parties,
other people.
Family get-togethers. People are just doing that. They're not listening to us. So this is what we want to tell everyone.
Because it's something that, do you think it's statistically likely that most of us will get it?
So
Maybe we should
Up to
say that on
80%
national
and more.
TV.
I think, this is a new infection. You have to understand that. And eventually it will infect everybody, perhaps.
Yes.
Because like you and Dr. Sab, I'm sure we have met the normal common cold coronaviruses before in our lives.
Yes.
I'm sure I have. I had many
And while
colds.
most of us will recover, it is important to understand that if we are responsible and we
Yes.
practice responsible safety measures, we are making it easier for our healthcare systems and for generally each other to stay healthy and remain so, and to at least slow down the rate at which people are getting sick, which is why this is so
Mina, there is a
important.
little bit more to that I do want to talk about, because this is something people don't know. So it is not just that we're slowing the transmission of the infection. You have to remember that coronaviruses mutate very quickly. So these viruses, this is one of the reasons why the common cold, every year, you can't vaccinate people against the common cold.
And the flu
because
shot
every year you
keeps
have to keep doing the
being
vaccine again and again. So there are epidemiologists, very respected researchers, who are talking about the fact that it is likely that 60% of the world will at least get infected. But that is not the only problem. The problem is that means that 60% of the world's population become bodies of reservoir that allow 100 million mutations for the virus. So what we're talking about is a new strain of the virus potentially every single year. So
I hope not, because I
that is
think-
what people are really worried about, including the gentleman that I was talking about, Thomas
Yes.
Payo,
Yeah.
who wrote a paper about this, and who is one of the most highly cited authorities on this at this point, at least data analysts.
And that data is promising in the sense that he basically says that if we all take these self-distancing and precautionary measures, we can kind of control the spread.
So Tomas is saying that if we can do what we call suppression instead of mitigation. Suppression means you clamp down.
Yeah.
Mitigation means you say, okay, we'll do some measures. You suppress, you use that strategy, you cut down the transmission completely, and that allows all the systems and the human body enough time to respond to this viral threat.
Absolutely. I think, and meanwhile, it's hand washing, and hand washing.
And disinfecting your phone.
Yeah, yes, and disinfecting the third hand. Remember to do that.
What's a good way to do that, by the way?
Well, I have a spray bottle, which I'm not going to disclose to you where it is, because everybody's asking me, where did you get this bottle from? It's quite an old one, from, so I just fill that up with the disinfectant and with the alcohol, of course, with the disinfectant, and then I just spray it from a distance. Again, you have to remember it has to be the phone which
so if you spray a cloth and wipe your phone down with it, it's fine, or computer, your screens and things like that.
I do have one message, public message, that I was asked to give this to the public by my colleagues. Okay. So I've been talking to the physicians at Chowkat Khanam and other places. Yeah.
Look into your camera and do it.
So one of the messages that Chowkat Khanam cancer physicians told me to give the public was, if you have cancer that is not requiring active therapy, see if you can delay seeking care. If this is not an emergency or an urgency, you may want to delay elective procedures or elective treatment options. And these are guidelines now all over the world, and they are guidelines that are being applied locally. So I asked my colleague very specifically, he's head of oncology at SKMC, and he said, yes, we do want people who don't have active cancer and do not need active treatment to delay seeking care and elective procedures, so we have ample time to regroup.
Okay, that's it. That's basically it. And also one sort of another thing is wearing a mask effective?
You see, it depends which mask it is. If it is a surgical face mask, you can contaminate it straight away after a few minutes when you touch it and put it on your face. Right. So the thing to remember is, if you're coughing and if you're unwell, you can wear it, because in that scenario, you will not be passing on and spitting out your droplets everywhere and contaminating all the surfaces around you. But for the doctors who are in the front line, I think they would need N95, they would need the gear, they would need the face shield, like in ICU and other places,
but if,
ER
for example,
stuff.
I was to go to the grocery store to get, something. Should I wear a mask?
You see, it's like everybody's wearing it now. You see all the pictures around you globally. People are using N95 because they had it and they are keeping it because...
So it's a good barrier for droplets?
Yes, also because you see, if somebody is coughing onto you, at least it will not go straight into your nose and mouth, but your eyes are spared. So if you're wearing glasses like you and Dr. Usman and myself, if we are wearing, so maybe that will protect us.
Ooh.
But then, on the sides, listen, don't get me wrong, because then from the sides, droplets can always go. So there are lots of ways you can really get the droplets in your eyes.
But if you are wearing a mask,
yes, I think for the mask, at least for the time being, I'm telling everybody, at least you are wearing it, even if it is contaminated. You know that you don't have to touch your face. Yeah. You remember that, because normally we don't wear a mask.
Yeah, that's true.
So there are two different views. Right. Some other channels have doctors telling everybody you don't need to wear, and I think this is the message that we were giving anyway. But I think what I see around me in the hospital, people now are aware that there is a pandemic, there is something serious going on, and we are wearing this mask. So at least they know that they're not touching contaminated areas and picking the droplets and putting in their mouth and nose.
So if you're wearing like a surgical disposable, and then now I'm sort of just thinking about ordinary people, should you just throw it away then?
You have to. In few hours it will be contaminated anyway. But because we only have few left, so I'm again spraying the alcohol.
Would a cloth mask be useful if you keep washing it?
It won't be useful because the droplets, the big one will stick outside, they'll stay, but the virus will still be able to go inside you.
Okay, so a mask is neither here nor there.
Well, I mean, there are different
uses. Okay.
I am using it, but if you know how it works, it'll help you. But if you are just not careful, if you're not careful, then it's useless because you will contaminate it anyway.
Okay. Thank you so much.
And then it's disposable as well.
It is disposable. Chuck it. Yeah. Thank you so much, both of you, for being on the show. And this is a lot of really useful information that I hope all of you will take to heart. Please share this show. The purpose of sitting this close to each other on this sofa was to help all of you stay safe, stay home. Please don't go to the club. please don't go and, exercise. Don't go out unnecessarily. The 3 H's.
Hands, hands,
handles, horizontal surfaces, disinfect your phone, stay home. This is, we're all in this together, and if we're all sensible and we all are careful, we will get through this together as well. Thank you guys for watching. Don't forget to like and subscribe, and we will see you next time on the coffee table. Bye now.
Thank you.